Hi viewers, this is your host Nurse Roslyn Odhiambo on Skills versus the Midwife, and today we are going to learn about the newborn assessment, the very initial assessment that is done on the newborn. This assessment will occur after the baby has been born. So what do we need to prepare therefore before we can proceed on and understand the rationale for doing the newborn assessment? Number one, we need to prepare ourselves. So we need to actually clean our hands so that as we are going to touch the newborn, remember we don't want to contaminate the new baby, and we also don't want to pass on any microorganisms to the new baby. So part of the preparation includes ourselves as the healthcare providers. Secondly, you have to make sure that the environment is very clean, the environment is well lit, and there is good ventilation in the room as well as warm. Remember, the newborn baby loses heat very quickly because of the small surface area, and therefore we need to protect it from losing any heat. Also, the couch where the baby is actually placed, all right, where you are going to assess the baby, so this is the surface I'm going to use, has to be also very clean, all right. And apart from that, then also we need to prepare the client, the mother who has just given birth, together with the spouse. For example, if the spouse is there with her, then we need to prepare them and tell them the normal consenting procedure has to be followed. So you need to explain to the client and also the spouse that it's important for you to carry out a newborn assessment for the various reasons that we are going to outline in a few minutes. And then also we need to prepare the baby. How do we prepare the baby? Just make sure that the baby has fed. And then, of course, once all that preparation has been done, then you will prepare your trolley. Okay, there are requirements that you'll need to put. So in the next video where we are going to start the head to toe assessment, we will be able to show you how the trolley looks like. All right, part of what you need in terms of equipment. Example, for you to do the head circumference, you need the tape measure. So let's move on to the second part of this video, whereby we want to talk about the rationale. So why is it important to actually carry out a newborn assessment? We want to assess the maturity of the newborn. There are instances where you realize that some of the newborn are born premature, and this could be because of events that could have led to that during pregnancy. If they have a multiple gestation, there is no way we are going to deliver babies who are term, okay? And term is how many weeks? That should be 40 weeks, okay? So we have to assess the maturity. And there are also other aspects that we'll be looking at in the newborn to actually ascertain that this fetus is mature, okay? So we are going to break that down in the next videos that are coming up. And number two, we need also to do a newborn assessment to actually elicit any complications that may have occurred. For example, we can have birth injuries. Yeah, so birth injuries can be very common, and especially in a difficult birth. All right, there are babies who could be born and they are not able to breathe, for example. So they could be having asphyxia, or they could be having respiratory distress syndrome. So all that can be picked, okay, as complications. Then number three, to assess for any congenital abnormalities. Okay, so these are defects that are generally there, okay, and the babies are born with them, so we can easily identify them and be able to manage appropriately the newborn and even do proper referrals if there is need. And number four, to assess its adaptation to extrauterine life. For example, I would expect the baby to cry immediately when it is born. That only signifies that the lungs are functioning very well. So the rationale for doing the initial newborn assessment, number one, is to assess for the maturity of the baby. Number two is to assess for any complications that might have occurred. Number three, we also want to assess for any congenital abnormalities. And finally, we also want to assess adaptation to extrauterine life. Watch out for the next series of videos whereby we are going to do the actual newborn assessment. Otherwise, thank you and see you in the next video.